Um, Madam Chair and committee members, thank you for the opportunity to speak with you this afternoon. My name is Evan Falchuk. I'm the president and COO of Best Doctors. Best Doctors provides a service that a lot of people call clinical advocacy. And I understand that clinical advocacy is part of what you're considering in the legislation before you. Best Doctors sells our clinical advocacy service as a benefit to employers across America and in about 24 other countries. We cover more than 10 million people. Every year, we help thousands of people take control of their health care. And we do it by helping them make sure that they have the right diagnosis and the right treatment. And I'll talk to you a little bit today about why that's important. There's two big reasons for this. First, every day, there are thousands of people struggling on their own with medical uncertainty, unsure if they've got the right diagnosis and treatment. Second, by helping these people get control of their health care and find the right diagnosis and treatment, you, as the people paying for their health care, can save a lot of money. I can illustrate the value of this best by describing for a moment how Best Doctors provides its clinical advocacy service. Our role as a clinical advocate is based on the core principle that every person is entitled to be sure that they have the right care. The reason this is important is that there are huge numbers of people that get the wrong diagnosis and treatment. According to scientific studies, as many as 1 in 5 people get the wrong diagnosis, and as many as half get the wrong treatment. Just this week, Thomson Reuters issued a study that showed that this quality gap, as I call it, is one of the biggest drivers of the $800 billion a year in medical expenses that are wasted in this country. Clinical advocacy fixes this problem by making sure people have the right care. And here's how it works. Best Doctors, as I mentioned, sells the service as a benefit to employers who give it for free to their employees. While the employers pay us for the service, the people to whom we dedicate our work are the employees and their doctors. And our focus is making sure that the employees and their doctors are able to work together to serve the best interests of the patient. A major part of our work is to educate employees to be smart, engaged healthcare consumers, to ask questions, and to make sure that they're satisfied with the answers. So here's a case example. We helped a woman recently. I'm going to call her Ruth, but that's not her real name. She works for a large manufacturing company, and she has Best Doctors as a benefit through her job. She was suffering from symptoms and was seen by her doctors who thought that there was probably some kind of a problem with her thyroid. So they sent her to a specialist, and they did a biopsy. They took out a small piece of her thyroid to check it and see if maybe there was something there that was causing it. The results came back inconclusive, so it wasn't clear at all what was going on. And so what they suggested to Ruth was that she should go home. They gave her some medications, and they said, come back for a follow-up in between 6 months and a year, and we'll see how things have progressed. Well, at first, Ruth accepted this, but after a few weeks, and she wasn't feeling any better, she called Best Doctors because she had it as a benefit. And she asked us for help. And when she called us, she was immediately put in touch with one of our nurses, which is the way it starts. We collected a detailed history of her condition. We asked her to sign a release. We go out and start to collect as many medical records as we can get our hands on, which included, in her case, the actual tissue samples from her thyroid. We then assigned 2 internists to review her case and identify what are the important issues that need to be looked at. In her case, we actually had the pathology examined. We then went into our database of nationally renowned experts and presented the case to the expert. And the expert looked at the case and said, in a case like this one, the pathology report that came back inconclusive doesn't mean wait. What it means is it's very likely cancer. Now, when we deliver this information, we package it up and we give that back to the patient and to their doctor. We deliver the report of the expert. We deliver the academic literature that supports the proposition. And then we work with the patient and their physician to figure out what they want to do with that information. In her case, they decided to go ahead with the surgery. And once they had taken out her thyroid, and now the doctors had access to the entire thyroid, they found out that it had been riddled with cancer. Had she waited 6 months or a year to be checked again, she faced the very high likelihood that she would have had not only the same surgery that she had early on, but a very difficult and challenging medical prognosis with cancer spreading to other parts of her body and difficult treatments to try to save her life. So the work we do at Best Doctors and the work of clinical advocacy is all about helping patients and their doctors get these decisions right. And as I said, getting these decisions right saves money. In the short run, maybe Ruth's case costs a little bit more because doing surgery is more expensive than doing nothing. But in the very short few months that followed the decision to have the surgery, she avoided a great deal of suffering and, importantly, avoided major treatments that would have cost a great deal of money and profoundly affected her life. It is, in fact, the surest way to have a real and immediate impact on the cost of health care. Our data shows that every time you help someone get the right care, you save as much as $20,000 per case on average. And I'm not in this counting the long-term costs of avoided medical treatments or the improved quality of life or the productivity or anything else like this. I'm talking about acute medical expenses. What I really mean to say is the right care is the cheapest care. If it sounds too good to be true, it should not. There is old wisdom that has guided our way as Americans for hundreds of years that's been lost in healthcare discussions. Take Ruth's case. Her case reminds me of the old adage, a stitch in time saves 9. Fix the problem now or try to deal with a more complicated one in the future. Or how about another one? Measure twice, cut once. It ought to be common sense that doing this kind of a second opinion is an obvious way to lower costs. And it ought to be second nature that we believe that. But whatever expression you want to use, the point should be clear. And all the complexity and all the actuarial analysis and everything we've piled on top of healthcare for the last 30 years in our country, we've lost sight of far too much of this basic American common sense. In real life, as many as 1 in 100 people each year face an important medical decision. As many as 1 in 5 of these people are going to be, like Ruth, starting out with the wrong diagnosis. As many as half of people are going to be starting out with the wrong treatment plan. But the result is always the same in these cases: unnecessary suffering and wasted medical dollars. You don't have to just believe me, though. There's increasing amounts of data from scientists, public health researchers, and the federal government that show that, for example, more than half of all doctor visits today involve 15 minutes or less with the physician. Most of us know what that's like. You're in a rushed meeting with your doctor. And doctors are the first ones to complain that when you force them to make complicated decisions with limited and fragmented information, things go wrong. I'm not talking about malpractice, though, when I talk about this. I'm talking about complicated judgments that just get made wrong because of the pressures of time. Now, it's not all bad news. Programs of clinical advocacy like what Best Doctors represent make it possible to fix this problem without changing the entire healthcare system. It helps patients become better informed consumers of healthcare, and it means you can have a real and immediate impact on the quality and cost of care. And already, many, many employers across the country are doing it. Best Doctors today serves companies in many industries: high technology like EMC, pharmaceutical companies like Wyeth, manufacturers like Delphi and Northrop Grumman, financial services companies like GMAC, trucking businesses like Schneider National, labor unions like the International Union of Operating Engineers, Local 4, back where I'm from, teachers groups like the Southern California VIVA and Allegheny County Schools Healthcare Consortium, and many, many others. These groups and the millions of people that work there are finding that by helping people get the right diagnosis and treatment, they can have a real and immediate impact on the cost of care and the quality of life of the people who they serve. Thank you very much.